Hi, I'm Dr. Christine Linkie, and I'm a clinical assistant professor in the Occupational Therapy program of Rehabilitation Sciences in the School of Public Health. Occupational therapists work in psychiatric units, we work in community-based mental health, we work in outpatient clinics, and it's all about function. Occupation means the things that we do to occupy our time. So it's all about helping people to develop the skills, but not only that, it's also to develop a sense of wellness and quality of life. I was asked, why do I think that mental health was chosen as a topic for this podcast? I have two answers for that. But the first one is that, as probably a lot of people know, there's good evidence to show that mental health of young people and of adults since the pandemic has really become more of an issue, and we see more people struggling with mental health challenges. So that's the first reason why I think, and the first thing that I want to talk about for a minute. And the other reason that I think it may have been chosen is that for people who have serious mental illness, so that is like schizophrenia, bipolar disorder, and also substance use disorder, we are in need of services for them and making sure that folks truly get the help that they need to live the full productive lives that they love. Let me talk first more globally about mental health and the pandemic. So when I was thinking about this, and the research is really showing that people are struggling more, one of the things that occurred to me is that we have reason to be hopeful. Because at the same time that people are struggling more, there are things that everyone can do, no matter where you live, or whether you're in a rural area or in an urban area. There's things that everyone can do. So I am an occupational therapist, and in occupational therapy, occupation doesn't mean job. Occupation means how we occupy our time. And that can be everything from your morning routine to caring for children, to going to a worship service, how you occupy your time. And there's research more and more to show that how we occupy our time, occupational engagement, is linked to mental health and wellness. So that to me is very hopeful, because that means that all of us can be doing things ourselves and supporting each other in doing things that are meaningful to us as a way to improve our own mental health. And also keeping in mind occupational balance. So what is meaningful for me and how occupied I am is going to be very different for someone else, right? So keeping in mind occupational balance. And the other reason why I'm really hopeful is that there is research to show that in terms of caring for our young people, a meaningful relationship with one caring adult is a protective factor against developing mental health challenges. So to me, that says that any of us can be that one caring adult. So that's something that we can do. So why am I hopeful about working with people who have serious mental illness and people who have drug use challenges? Well, for a number of reasons. First of all, our governor and our state budget, have dedicated increased funding for supportive services, and I think we're going to see that happen more. I also see that here locally in Western New York and across the state, there is more of a commitment to services, and it's interdisciplinary. So it's occupational therapists, psychiatrists, social workers, counselors, and people who don't have degrees, all working together to support mental health services. And it's peers also, so peer-based services are really important too. So knowing the folks who work in these areas and the commitment to it, I am hopeful. So in both of these areas, both for mental health on an everyday level, there's things that we all can do, and there's things that we can also support services for people who have serious mental illness and substance use disorders. So I encourage everyone to get involved, to take care of your own mental health, and to take care of each other. Another thing that I wanted to make sure that people were aware of is that if you or someone you know is experiencing a mental health crisis, that you can call 988. You can also go on the website, 988.org. It's a really good resource where you can find different resources to support mental health.